In my experience, there's a huge crisis going on in senior care today. 95% of caregivers are daughters and daughters-in-laws. And the other statistic that addresses this is that 70% of those caregivers are dying before the person they're taking care of. Caregivers are dying before the ones they're caring for because they won't ask for help. They have been raised to thinking that they can do it all. They're taking care of the kids, they're working. Well, we help seniors find caregiving services for in-home, board and care, or assisted living in the geographical location they're looking for, in the budget that they have, and based on their needs, if they have dementia, if they're diabetic, or if they just need housekeeping or medication management. I've been in healthcare for 18 years. I'm a gerontologist. I educate the Board of Registered Nurses as well as the California State Legislature on senior issues. I sponsored Medi-Cal reform legislation that became law, and I'm proud to say that that law has given seniors who are on Medi-Cal choices to live either at home or in assisted living instead of being forced into nursing homes. One of the myths that I address in the book is that people think that asset protection, that you have to spend down in order to protect your assets, and that's just not true. There's government entitlement programs that were created specifically to protect people's assets. One of the cases that we've worked on and we helped was a 67-year-old man. His health was deteriorating. He was taking care of his 92-year-old father who needed dialysis 3 times a week, and he had promised his dad he would keep him out of a nursing home. He was staying with his dad 3 weeks out of the month, and 1 week a month he would go home to his wife, and his sister would fly out for that 1 week. All the dad's income was going towards his dialysis treatments. We came in, we found resources that paid for all his dialysis treatments. We got him an additional $20,000 a year for income to help pay for his care. Now the son was able to hire a caregiver to come in so that he could go home during the week and have a better quality of life, spend time with his wife. He was elated. He was just so happy that there was resources out there to help pay for his dad. It was awesome. It was very rewarding. I know this guy's going to live longer now. He might, live as long as his dad. I mean, hey, that's awesome. Maybe even longer than his dad. My clients definitely feel guilty. It's one of the biggest problems that I see. They're burned out. They've been taking care of their loved one. They have had no time for themselves. They're literally exhausted, and they're at their wits' end. They're just saying, please help me. If you're not here to take care of your mom and dad, who is going to be there for them? So take care of yourself first, and we'll help take care of your mom and dad.